Another day, another story. This time, how to transfer a patient from nursing home to tertiary care hospital who needs enhanced care. The general steps that may be involved in transferring a patient from a nursing home to a tertiary care hospital during an emergency. Assess the patient's condition and determine the need for transfer. The nursing home staff or the treating doctor should evaluate the patient's vital signs, medical history, and current symptoms to determine if the patient requires urgent or specialized care that the nursing home cannot provide. Discuss the patient's condition and explain the need for enhanced care to patient's relatives and take their consent. Notify the hospital and arrange for transfer. The nursing home staff or medical personnel should inform the tertiary care hospital's emergency department about the patient's condition and the need for transfer. The hospital will then accept the patient and arrange for transportation. Prepare the patient for transfer. The nursing home staff will prepare the patient for transfer by ensuring that the patient is stable, has all necessary medical records and medications, and is comfortable during the transfer. Coordinate transportation. The nursing home staff or medical personnel should arrange for transportation to the hospital, which may involve an ambulance or cardiac ambulance depending on the patient's condition and distance to the hospital. Accompany the patient to the hospital. The nursing home staff or medical personnel will accompany the patient, if the medical support team is not available in ambulance, during the transfer to the hospital to ensure continuity of care and to provide any necessary medical interventions. Hand over the patient to the hospital staff. Upon arrival at the hospital, the nursing home staff or medical personnel will hand over the patient to the hospital staff, who will then take over the patient's care. Follow-up. The nursing home staff should follow up with the hospital to ensure that the patient is receiving appropriate care and to coordinate any necessary transfer back to the nursing home once the patient is stable. It's important to note that the exact steps involved in transferring a patient from a nursing home to a tertiary care hospital during an emergency may vary depending on the patient's condition, the hospital's policies, and the resources available. Thanks for watching. Please subscribe to YouTube channel Prakash Gadgil.